let's talk about some client education tools. So what we did was we created this thing called the Success Kit. All right, this is what it looks like. It's this big, okay? And in the Success Kit, the objective when we created this was so that people didn't have to reinvent the wheel. All right? The objective was so you can selectively plagiarize and copy everything that's in the Success Kit. Okay? So we said, what do we need? What do hospitals need to help them, give them the tools to be able to talk to clients and let them know how important oral health care is? What do they need? Well, let's see. Let's think about this. First of all, they need client education handouts. So they need to make sure that based on stage of disease, their go-home handouts are consistent. They need to make sure, this is all sticky, they need to make sure that they have handouts that they can put into their medical record system that all they have to do is populate it with the client name and make a first paragraph that says what they did. And we're going to go over this in the next hour. But we made all those handouts and we put them on this, isn't this cute? This is a little Milkbone. Put them on this Milkbone USB stick, okay? And the reason is that you can then plug it into your computer and this whole book of handouts comes up. And all you have to do is put your logo at the top and it's done. And they're Microsoft Word documents. So if you say, well, I don't like the way they worded this, then you just change it. But the basis for the backbone is here. Okay, the backbone is here. You just need to make it work for your hospital by putting your logo, your words, how you do your procedures into this. And we're going to go through what we use these for in the next hour. There's dental charts in here, dog and cat dental charts that you can use and rip off and use when you're doing your probing and charting, which you're going to learn about next time. One of the things that we needed to do was that owners don't understand what's involved in a dentistry procedure. They don't get it. They don't get all the things that happen from the time the patient gets admitted to the procedure to the time it gets home. They go home. So what we did was we created a picture PowerPoint presentation from the time the patient gets admitted to the time the patient gets released. And we put it in a PowerPoint presentation, and for those of you young people in the room, you'll understand this much better than I always do. You can take that PowerPoint presentation and you go boom to Shutterfly, and Shutterfly creates a book. Okay? So on that USB stick is the PowerPoint presentation, and it starts with, this is Zelda, this is really her name, this is a patient of mine. It starts with her at the beginning. It shows IV catheter and fluids, blood work, what we do during the procedure, taking radiographs, oral surgery, Zelda ready to go home. Okay? The reason we made this template is so you can take pictures at your hospital of your doctors and your technicians and your patients, and all you have to do is drag and drop. You know, Control-C, Control-V, copy-paste, got it? Drag and drop into the PowerPoint and then send them to Shutterfly, and now you've got this. You can put your logo on the top front. You can do whatever you want. Now you've got this, and this book should sit in your reception area, and it should sit in every single exam room. Because maybe your doctors, as soon as a patient gets loaded into the exam room, maybe they come right in. But in most cases, in most hospitals, everybody's laughing, right? In most hospitals, the owner has to sit there for a couple minutes. So rather than reading outdated books or magazines or whatever's there, what if they page through this and go, whoa, this hospital, look at what, whoa, they don't just clean my dog's teeth. Look at all this stuff they do. This isn't the same thing I get done at my groomer, what they're doing here, right? So they see that dentistry is important, and they can see why we do what we do, and they understand the procedure. What else is in here? What's people's biggest freak out? Anesthesia. Will my pet be okay? Brochures for you to use for your client. It goes through and explains about anesthesia. Why do we do preoperative lab work? Why do we use IV catheter and fluids? What kind of anesthesia monitoring protocols do we do? How are my teeth? How are my teeth? So this is a brochure that explains the dentistry procedure that we're going to do. It's got a little report card. So it forces you as a doctor to make a commitment. One of the things I want is I want the doctors to make a commitment. I want you to do a good oral exam and say something about the mouth. So it forces you to do that. It forces you to make a recommendation. Even if the mouth's perfect, you should be recommending home care. Even if the mouth's perfect, you should be recommending home care. What else do we do? So the important thing is that what we're trying to create is we're trying to create an environment in your hospital where people understand that oral health care is important. So radiographs. People, my clients will never pay for radiograph, okay? What if you had this in your exam room? And when that client's sitting there waiting for Dr. Charlier to come in the exam room and they're looking around the exam room and says, whew, dental radiographs beyond what your eyes can see. Wow, look at Maury, an 8-year-old cat, had tooth resorption lesion on his gum margin. Whoa, Gracie, an 8-year-old Papillon. Poor Gracie, I called her a Papillon. Had her canine tooth up in her nose. They're actual clients with actual stories, actual patients. What if that's sitting in your exam room and they see this and they see this and they get one of these when they check in and you can use one of these and you've got go-home handouts to give them and you don't have to reinvent the wheel, okay? So we created this success kit as a result of the study that we did and as a result of feedback from the 5 hospitals.